Okay, we're going to be doing chapter 22, which is the lymph system and the immune system. Immune system and the lymph system work together to protect our bodies from various invaders. These invaders can come in the form of fungi and viruses and bacteria and parasites. And each one has a specific, unique way of attacking the body. So with the fungi, they're multicellular plant-like cells. So when they find a nice warm environment with enough nutrients and moisture, they move in. It might be your toenails, it might be some other orifice in your body, but once they get in, they can take over and take nutrients away from your cells and grow and enjoy their new home. And so our body needs to be able to have a way to destroy them and move them elsewhere. Viruses are like little protein pouches here that are, they contain a little bit of RNA or nucleic acids that code for certain proteins, specifically viral proteins. And then they have receptors on their structures here that can bind specifically with different cells in our body. So let's say this is a rhinovirus. So this would be a cell inside your nose, and that cell inside your nose would have the right proteins on its cell wall to bind with the virus. Once the virus is bound, it's going to inject its RNA, and it's going to start replicating its viral proteins inside the cell until the cell bursts open and the little viruses that it has made go out all over the place and start infecting other cells. So very bad. Viruses need to be able to be disrupted before they get that far. Bacteria are little unicellular critters, much smaller generally than our own cells. But once they get into our bodies, they might not be all that bad for us, but if there's too many of the wrong kind of bacteria that create toxins or secrete toxins, they can cause infections and sepsis and damage to our tissues. And if they cause enough damage and there's enough toxins, they can actually overwhelm our bodies and it can be fatal. Parasites, these are like worms and other multicellular organisms that can come in and use our bodies as hosts for parts of their life cycles. So they might come into our bodies, this is the wall of our intestine, the worm can hook onto there and then grow and steal our nutrients until it gets bigger and bigger and bigger. Then it may decide that it's going to lay eggs inside of us. Those eggs can sometimes get through into our tissues and travel to other parts of our bodies, and they're hatch and grow later. So we can obviously have quite a bit of tissue damage as well as a disruption to our nutritional status because of parasites. So our body has to be adapted to specifically target all these different types of invaders. They have to have specificity, and they have to be able to recognize when something is not part of our own body. So they have to be pretty complicated. They also have to be able to recognize when something happens inside us that isn't normal, like cancer. We have to be able to see our own cells when they go rogue and be able to destroy them. So the lymph system and the immune system work together to help trap or corral these little invaders, recognize them, and then disarm them. So within the lymphatic system, of course, we have the lymphocytes, which are the main cellular components of the lymphatic system, the troops on the ground, so to speak. They're able to identify and attack invaders. So they're able to tell when something is not part of our body and identify it, label it, and then attack it, sometimes very directly. Also, they can plan for next time. So they can get a setup that is specifically designed to readily and efficiently identify and attack any pathogen that gets into the body the second time. Lymphoid tissues are those that help produce and mature those lymphocytes. The primary lymphoid tissues are the bone, marrow, and the thymus. They make T lymphocytes and B lymphocytes, which we'll talk about more later. The secondary lymphatic or lymphoid tissues include the spleen, the lymph nodes, and the mucosal associated lymphatic tissues called multa in the digestive system. So again, these ones are the primary lymphatic organs and lymphoid tissues, and then the spleen, the lymph nodes, and Malta are additional tissues that house and help to activate the lymphocytes. The vessels, the lymph vessels, connect all these. They are filled with lymph. Okay, the lymph in the vessels is derived from intercellular fluid, and is very similar to plasma. Plasma proteins are lacking, but the interstitial fluid leaks into these lymphoid vessels, and they kind of look like this. They have these little overlapping epithelial cells here, and they allow fluids to push in, and sometimes larger substances as well, because they're pretty leaky. But once they've leaked in, they can't leak back out. They have to stay in, and then the pressure of things leaking in creates a one-way flow in the lymphatic system, and those vessels join and join and join until we get larger and larger vessels. They usually pass through lymph nodes in order to clean and purify this lymph before they get back into circulation. And again, we talked about specifically the lymph organs are the bone marrow, the thymus primarily, and then the spleen, lymph nodes, and Malta are those secondary lymphatic tissues and organs. Okay, we'll be discussing each of those in more detail. So the specific functions of the lymphatic system, we've kind of touched on most of them already, but they are to produce and distribute those lymphocytes throughout the body, so they are present in the tissues when invaders arrive. They help to mature and develop the lymphoid cells. They return excess fluid to the bloodstream, so they're collecting fluid, and we talked about that a little bit back in the last chapter, where we talked about the fluids that are not returned to the venous end of the capillary bed have to be uptaken by the lymphatic system, and that's where that excess fluid, that about 3.6 liters of fluid is leaked into the tissues, not returned through the venous system, and has to be returned to circulation via the lymphatic system. They also have to transport hormones, nutrients, and wastes throughout the body, similar to what blood does, but with a slightly different mechanism in general. As we mentioned earlier, those lymphatic vessels are larger in diameter. They have a large diameter so that more things can be traveling through them. And then if we look at a long section of them, they have that overlapping epithelial cell walls that allows things to leak in and not leak out, right? So this would be kind of a cross section with a larger lumen here with larger leaky holes for a lymphatic vessel, and then this is a longitudinal look at them. They travel close to the surface of the skin, as well as some of them more deeply. They're usually close to the venous and arterial capillaries as well. They have thinner walls, even thinner than the capillaries, which is makes them extremely fragile and easy to compress. And they have a more flat and irregular line if we were to cross-section. So I've made this look fairly round, but in reality, if you were to try to section them on a microscope or look at them under a microscope, they would look quite irregular because they just don't have very, in the structure, the integrity of their walls is really compromised by preparation of slides. Okay, so the other thing about them is that they, like we said, are one-way flow, and they're closed-ended. They don't go to a capillary bed and then interchange with another system. They pick up fluid and they go only in one direction. There's no circulatory pumping mechanism that occurs with the lymphatic system. Okay, and like we said, those larger diameter vessels can pick up larger substances like viruses, bacteria, and proteins can be picked up by the lymphatic system, taken to lymph nodes, and cleaned up before they end up getting back into circulation. Another feature of the lymphatic system is lacteals. Lacteals, these are specific little vessels inside the digestive system. So if this is the surface of the intestinal wall, kind of folded like this so that we have lots of surface area for absorption, and you have a little artery coming in here, a little vein coming in here to pick up things like glucose and such from the lumen here where the food substances are coming in and helping with digestion and absorption. The lacteal is a one-way channel inside each of those little villi. We call these little wrinkles. And each of them has this one-way lacteal channel, which helps to pick up larger absorbed food substances, such as microchyle, things like that, which are large, kind of like little fat dropules that are too big to get into the capillaries. So they get into the lacteals. The lacteals then take them into the lymphatic system, and the lymphatic system eventually returns it to the to the circulatory system, and so that those nutrients can also be absorbed and utilized by the body. Okay, looking back now, we're going to look at the way the lymphatic system is laid out throughout the body. Okay, so we have superficial lymph vessels that run just under the skin in that subcutaneous tissue there, and they collect a lot of the things that can get through our skin barriers. So if you have small cuts or bruises or anything like that that introduce foreign objects into the skin, the lymphatic system there is quick to pick that up. They're going to join deeper and deeper vessels and get into the tissue where they're going to be running along with the arteries and the veins. So they form what we call ducts as they join and become larger and larger. So we have the main thoracic duct is emptying here into the left subclavian vein that goes directly into the heart through the superior vena cava here. And then we have the right subclavian vein that receives the right lymphatic trunk. I said that wrong, the lymphatic duct. So the thoracic trunk empties into the thoracic duct here and then into the left subclavian vein, and the right duct is joining together of these other trunks. So we're going to go through each of those separately here. The thoracic duct is this larger region here, and it is formed by, let me switch markers here so we have the purple one here. Okay, it is formed by the cisterna chyli starting at the bottom here, which is a larger area. Cisterna, and it's spelled chyli here. The cisterna chyli, cisterna meaning like a well, right? So it's kind of like a storage area sort of for the lymph. There's also lots of lymph nodes in the inguinal area here on both sides, and those are the inguinal lymph nodes. And then behind the knee you have the popliteal lymph nodes down here. So as the lymph vessels are going deeper into the tissues from superficial to deep, they are being forced through lymph node regions and getting cleaned up there before they can move more proximally. Okay, so back to the thoracic duct here. It's the joining together of the right and the left lumbar trunks. So these are the lumbar trunks. Lumbar trunks here joining together to form the thoracic trunk here. We have the bronchiomediastinal coming from the lungs and the mediastinum around the heart here. We have the left subclavian trunk coming up here. The left subclavian trunk, that's coming from the left upper arm. And of course you have axillary lymph nodes there, and also some lymph nodes in the elbow that help to clean the lymph coming from the hands and the lower arm. They're going to come up through the axilla into the left subclavian trunk and then empty here into the thoracic duct. The cervical lymph nodes here are draining the left side of the head there, and that's the left jugular. That's supposed to be a U, jugular trunk here as it empties into the thoracic duct on the left there. So all of these are draining this entire left side of the head, left arm, majority of the left side of the trunk here, and the lower limbs, all draining into the thoracic duct. Thoracic duct here. And then that is going into the left subclavian vein, into the superior vena cava, into the right atrium. On the right side, we have a little different story. We have the lymph being collected. Let me try a orange marker here. We have the lymph being collected from the hand and the arm, going through the lymph nodes in the elbow, then the axillary lymph nodes, and then into the right bronchiomediastinal is coming through here, up into this area here. This is the right subclavian trunk here. Then we have the right bronchiomediastinal trunk, so that's draining this part of the chest into the right side. And then you have the right jugular trunk here, draining the right side of the head and neck. And then of course you have all the right cervical lymph nodes as well. So all of those lymph nodes drain lymph from the head on the right side, from the face, excuse me, and then into the right jugular trunk. The right subclavian trunk is draining the upper limb and the axillary nodes here. And then the right bronchiomediastinal, meaning from the lungs and the mediastinum around the heart, that trunk empties into the right thoracic duct, which then empties into the right subclavian vein, into the superior vena cava, into the right atrium. So just to recap, the whole point of this is that the left side here drains the left arm, the head, the left side of the thorax, the abdominal cavity, and the limbs, the lower limbs here, all into the thoracic duct. On the right side, we're just draining the head and the right arm and the right upper part of the thoracic cavity. Okay. So when you're doing lymphatic treatments, right, and you're trying to move the lymph toward their exit point here into the circulatory system, you're going to be thinking about how these passages are arranged, right? So for the right side, you're going to be trying to drain, everything toward the right subclavian vein. On the left, you're going to be trying to drain it toward the left subclavian vein there. And then from the lower part of the right side of the body, you're actually trying to drain toward the central and the left side of the body. So it's an interesting thing. It's not exactly symmetrical left and right. So one of the things that can happen with the lymph system that is a problem is lymphedema. And lymphedema just means a blockage somewhere in that system we were just looking at. So if any one of those one-way channels gets blocked, the fluid, the interstitial fluid that's not being drained into the system from that area will build up in those tissues, and you'll end up with swelling. And we call that lymphedema when the swelling is not necessarily an infection per se, it's a blockage in the lymphatic system, which could mean that there is some infections in a lymph node. It could also be scar tissue, it could be damage to the lymphatic system structure, it could just be a pair of tight socks that's not letting the lymphatic system drain. So lymphedema is when the lymph system is blocked and the lymph is no longer being able to move normally through the channels and towards systemic circulation. It can cause really severe swelling if it's not treated properly. A lot of people have transient sorts of systems like this where they swell up at one point, but then if they change positions and things, that swelling can go down if the lymph system is no longer impeded. But true lymphedema or severe cases of lymphedema are when those lymph nodes or lymph channels are disrupted significantly, such as when someone has breast cancer and the lymph nodes are removed. That can cause a lot of lymphedema issues, especially in the upper limbs. Okay, lymphoid cells now. These are the cells that make up the lymphoid tissues, okay? They're very important. They're supportive cells, and they're part of the development of the immune system. And then a subcategory of that is the lymphocytes that we have mentioned already. Lymphocytes, and they make up about 20 to 40% of circulating leukocytes or white blood cells in the body. We've talked about those when we talked about the blood cells in our previous chapters, but 20 to 40% of circulating white blood cells are these lymphocytes. Okay, so they make up a lot of them, but most of them, as you can see, 80 to 60%, or I should say 60 to 80%, are stored in lymphoid tissue, and they're not circulating. They're getting, they're just there and ready to be deployed if needed. There are three main types of lymphatic cells. We have T cells, which mature in the thymus. We have B cells, which mature in the bone marrow. And we have natural killer cells, or NK cells, which are generally deployed in the tissues. They're circulating in the lymphatic system and working to identify foreign components that can get into our bodies and cause problems. We have these lymph nodules, which are widely distributed regions, or throughout regions of the body, and they are kind of collections of lymphoid tissue that help with our widespread immune response. So if imagine this is the mucosa in the intestine. So here you have the intestinal mucosa here, some submucosa here. These regions here would be the lymphoid nodules. And it would be a dense kind of area where we have lots of mature lymphocytes here that are ready for doing their job. And then in the center, you have this germinal area where we have developing and dividing lymphocytes here in the middle. So this is your germinal center, and you have the lymphoid tissue around it, or lymphoid cells that are mature and more or less ready for action around that. So these can be distributed lots of different parts of the body. They're contained within lymph nodes. The spleen has a lot of this lymphoid tissue in it. The respiratory tract has the tonsils, and then the digestive system, as in this example, as well as the reproductive tracts, urinary tract, etc. So a lot of areas in the body need to be prepared for invasion, and that's what these lymph nodules are for. And the example here in the mucosa is referred to as MALT, or mucosa-associated lymphoid tissue. And those are aggregates, again, of lymphatic cells within the intestinal epithelial lining. And the appendix is an area where we have a lot of this lymphoid tissue. So the appendix plays an important role in the immune system. It's right at the junction between the small intestine and the large intestine, and so it's in a key region to help identify invaders. If it becomes infected, of course, with like an appendicitis, and it does rupture, clearly that's a major problem because you're spewing, whatever it's been trying to stop from getting into the abdominal cavity throughout the abdominal cavity. So appendicitis is a very serious condition of the lymphoid tissue within the appendix. Okay, so here we have a simple outline of where the tonsils are. We have 5 tonsils. We have the pharyngeal tonsils here, also known as the adenoids. So I should say there's really just the one pharyngeal tonsil here. And then we have a left and right palatine tonsil. So I'm gonna just give you the names here. Pharyngeal or adenoid, the palatine tonsils, and we have a left and a right. And then we have the lingual. And there is a left and right as well. So that's where the 5 tonsils come in. And these are aggregates of lymphoid tissue that are there to help protect, again, a very large entrance point into the body where a lot of pathogens could get in from both the digestive and the respiratory system. So a very important place to have lymphoid tissue. Of course, they can become themselves problematic if they get too large. They can create problems with snoring, swallowing, gagging, all sorts of problems. And we used to think they were great to just remove quickly. Now we're a little bit more cautious and remove them with a little bit, more care. But many of us have had our tonsils removed, and that can be an issue, although as an adult, hopefully your immune system is well enough developed that you won't miss them too much. But as children, I think it's nice to have those as long as possible. Of course, if you get an infection in one of these, it is called tonsillitis, and hopefully none of you have had that too frequently because it is not fun. So we just talked about lymphoid tissues. Now we're going to talk about the lymphoid organs. They're a little bit different in the sense that the organs actually have very encapsulated lymphatic tissue. So they have a little more structural integrity, if you will, and they include the lymph nodes, which we will look at really carefully here, the thymus, and the spleen. Okay, so first of all, let's look at the lymph nodes. So a lymph node itself, it has kind of this internal structure where it's got these little trabeculae. So it divides itself into sections, if you will, functional units with lymphoid tissue in each of these units. And each of these little struts in between are called trabeculae. there are lots of afferent lymph channels connecting to a single lymph node. So these are channels where lymph is coming in, lymph and debris that's been collected from the periphery. And then this area here, called the hilum, we have a single efferent lymph duct here. So we have lots of channels coming in and not so many going out. And that's important because it helps to keep lymph in here so that we have time to process it. Also at the hilum, we have the artery coming in here and branching to supply blood, and we have a venule exiting so that there's blood supply to the lymph node as well. Okay, so as the lymph is coming in here, it first goes through the capsule into the subcapsular space. And in the subcapsular space here, we have lots of macrophages. We'll put that in here. Macrophages, which are large immune cells that are going to be attacking invaders and destroying them. We have dendritic cells. And these dendritic cells are good at recognizing pathogens and antigens that are getting in and are not part of what should be in the lymph, right? So they're going to recognize invaders right away and destroy them if they can. These are our first line of defense as it comes into the cortex. Then you're going to go into the cortex of these individual little compartments here where we have a lot of additional immune cells. So initially we have a cortex here with lots of B cells, okay? And then in the center we have germinal region where the B cells are being developed. So we have a germinal center here and then a cortex with lots of B cells in it. And the lymph has to get through these B cells. So this is the subcapsular space, and then we have the cortical space here, or the cortex of these individual lymphatic nodules within the node. Okay, so again, cortex, B cells, developing B cells in the medulla. So the lymph has to get through there. And the B cells are really good at picking up on specific types of invaders and recognizing them if they have the right recognition equipment, let's say. Okay, so we'll talk about that more specifically later. But the lymph continues on through this cortex and past the germinal centers and then into the paracortex. And in the paracortex here, I'm just going to change the color here a little bit. We have T cells, lots and lots of T cells. So this is a T cell zone here in the paracortex. So we'll put here T cells, and this is the paracortex. So the lymph again goes through the cortex, or the capsule here into the subcapsular space with the macrophages and the dendrocytes. Then it goes into the cortex of these lymphatic nodules, which are within the nodes. And there's B cells, germinal centers, and then in here where we have the T cells. Okay. Then eventually they get in here to the medulla here, and in the medulla we have more B cells, and we have macrophages again. So again, a last check before we're allowed that lymph access to the efferent or the exiting efferent vessel there. And it will be able to leave the lymph node at that point. Okay, so lots of levels of checkpoints, if you will, for that lymph and anything that it's carrying to be destroyed if it's a foreign body before we let it go out and back into circulation. So in this way, we were able to remove 99% of the antigens that get into our tissues. The antigens released due to infections and such, when they enter this lymphatic system, the B lymphocytes do recognize them. The dendritic cells here in the tissues can actually bring them to, they drag them into the lymphatic systems essentially and bring them to the lymph nodes for identification by the B cells. Then they're going to then mount an antibody response as well, which we will talk about further when we get into the immune system more deeply. So the antigens that are released then can travel into the plasma or into the lymph, and then be distributed throughout the body to help recognize any of the similar invaders that have gotten in somewhere else. So we're monitoring for peripheral infections, and we were able to respond before all this stuff gets to our vital organs. The largest lymph nodes that we have are in the groin, inguinal areas, the axilla, or axillary lymph nodes, because that's coming from the hands, and of course we're touching a lot of stuff. We get lots of little cuts and scrapes in our hands, so a lot of stuff's coming in through our upper extremities, and that gets caught by those axillary lymph nodes. And then our cervical lymph nodes, which are at the base of the neck, those catch anything draining from the face or the head. Those are the main ones, okay? And we can check those frequently, like when you're doing a basic screening for patients to see if they have any infections. You can feel these areas to see if lymph nodes are enlarged or hardened. That would indicate a potential infection in those regions. A lymphadenopathy is when you have a chronic excessive enlargement of those lymph nodes, and it can indicate sometimes the presence of severe infections or cancer. So checking for swollen lymph nodes is a primary screen that we do as healthcare providers. So one of the primary organs of the lymphatic system is the thymus. The thymus is located here sort of superficially in the mediastinum area, which of course was near the heart and the lungs. It tends to atrophy as we get older. Specifically, it enlarges up until about puberty, and then after that it slowly decreases and functions less and less and atrophies. It is divided into two lobes, left and right, and then into additional little septi here, divided into little lobules. So the T cells are developing kind of in the cortex, or the thicker outer region of the lobules here in the thymus. And then as they mature, they migrate into the medulla, which is a paler central region of the thymic lobes. Okay. So the lymphocytes in the cortex, they're surrounded by protective layers known as the thymic Hansel corpuscles. So these are in the cortex here, and they help to maintain a blood-thymus barrier to prevent the bloodstream from interacting too much with the developing T cells. Those are absent in the medulla. So once the T cells are more mature and they get into the bloodstream, they're then going to be carried out into circulation once they get into the medullary bloodstream here. The thymic hormones are thymosin, which is an extract from the thymus containing additional hormones, and it helps to promote the maturation and of the T cells themselves. So T cells are produced again in the thymus, primarily in childhood and early adolescence, and then the T cell production declines as we age. So just to kind of identify the location again of the thymus, it is right here in the mediastinum. Here's the thymus. Of course, these are the lungs, the heart, and then the trachea coming down here, and then this would be the thyroid gland that we're about. So the thymus is below the thyroid gland. So when you see goiters and stuff up in the neck, that's what you're seeing, the thyroid gland. The thymus, you have your clavicles coming through here, right? So this is underneath the sternum, and you're not going to be able to palpate or see that so much. Our next organ of the lymphatic system is the spleen. So it's a secondary organ. It's not a primary organ. It's not where the lymphocytes are produced, but it is where they do a lot of their work. So the spleen is tucked up right beside the stomach. So if we have the stomach here, and here's the rib cage and the diaphragm above it, the spleen is tucked in right beside it here. And it's connected to it by a little ligament here. So the spleen has these kind of little indentations. This would be where the gastric indentation, where it's bumping into the stomach. This is a renal indentation where it's bumping into the kidneys. Okay, and then this is the hilum in the center, where the blood vessels are going through your arteries, your veins, and your lymphatic vessels, entering and exiting at the hilum of the spleen here. And its main functions are to remove abnormal blood cells. So our old blood cells that have gotten to their 120-day mark, they're damaged maybe, or abnormal, and then the spleen is going to remove them. It's going to store a lot of the iron from other recycled blood vessels, so we're going to have a lot of iron here. So if something happens to the spleen, we do lose a lot of that iron. It helps again because it has a lot of lymphatic tissue in it. It helps to initiate the response of the B and the T cells, our specific immune responses to circulating antigens that manage to get from the blood and into the spleen. So the spleen has lymphatic vessels, but it is also a main area for cleaning up the blood itself. So not just lymphatic flow, but plasma and blood as well. So the ligament that I mentioned there is the gastrosplenic ligament. Because this is attaching the stomach and the spleen, obviously. And then the histology of the spleen itself. We have red pulp and we have white pulp. And as you can imagine, the red pulp is where we have more RBCs or red blood cells, and where we have the white pulp, it's where we have more lymph tissue or white blood cells. So these arteries, as they enter the spleen, are going to divide and divide and divide and divide. We call them trabecular arteries, and they're going to take them into regions that are surrounded by the white pulp. The white pulp being that lymphatic tissue. So I'm going to kind of illustrate it with yellow here. So regions of white pulp, which is going to be full of lymphatic tissue. So these arteries get smaller and smaller until they turn into sinusoids, which are those capillaries with very leaky walls, and they can come into pretty close to direct contact, if not direct contact, with the lymphatic tissue in this white pulp. Okay, the red pulp is areas where we have the blood circulating, and we have free macrophages in that region also, helping to clean up the blood itself directly. So again, you have the capillaries getting smaller and smaller, entering eventually the sinusoids. The sinusoids then join up to form the trabecular veins, which then bring that blood back and then take it back into circulation. So you bring it in through the arteries, take it into the sinusoids, where it can come directly into contact with the lymphatic tissue, which is the white blood cells, the macrophages, the B cells, the T cells, etc., that are all going to be able to recognize foreign pathogens and destroy them before we send that blood back into the venous system and send it back into circulation. We generally don't like to lose our spleens. They're pretty important, but in certain traumas where the spleen is actually ruptured, it may need to be removed to prevent severe bleeding, and that is called a splenectomy when it's removed.